As we look at the different sites, they are going to likely be priced differently, and they will cost, and that amount of money could be multiple millions of dollars, and that'll be a factor as we evaluate the different sites, which is more expensive versus less expensive. None of these different criteria, I don't mean to suggest that this is the exact order we're going to rank them, but the cost is obviously going to be an important factor. Other costs, in addition to the acquisition of the land, will be infrastructure. And this infrastructure takes two forms. Transportation infrastructure. Do we need to widen a beltway ramp? Do we need to widen a major highway? Do we need access roads to the site? All these type of transportation improvements, and they're different by the different four sites, are factors we'll have to take into consideration because they'll go to the overall cost of the facility. But on-site infrastructure costs are also important. Do we have access to water? Do we have access to sewer? Is there telecommunications access? All of these factors will be different in the different sites. There's one site where the facilities are right there. There's another site where we're going to have to go some distance to connect them. Those distances translate to different costs, and that'll be one of the things we'll think about. The size of the site. This has actually been an evolving process, and all of the partners, we've had many discussions, and we've heard from many members of the community that have helped us actually focus our attention. Initially, we were looking at about 120-acre site altogether. Then we thought we could get away with maybe 90 acres. We're now working with a number right around 40 acres. And that's a plus or minus, but we need a site that not only will meet all of the needs, they'll also house medical office buildings, parking facilities, again, restaurants, maybe your senior housing will be part of an ultimately growing campus. So we need a site that will accommodate all those. Timing. The different sites have different things on them or not on them. And our ability to get to control of that site, the ability of Dimensions, the University of Maryland, the state, and the county to collectively get control of that site so when they file the certificate of need is different in the sites. Faster is better than slower. And that will be a factor as we look at the different sites. And finally, and the ladies and gentlemen who have been part of this group have helped educate me. When you select a site for the Prince George's County Regional Medical Center in the year 2013, you need to be thinking about 2035 and 45. You need to be thinking about the future. Can that site accommodate growth? Can it accommodate maybe facilities we don't even know about now, we're not even thinking about now? I'm now going to quickly go through the four sites just to make sure everyone knows where they are, and then it really is my goal to get out of the way and let you all take over the microphone and talk. And there is no particular order by these four sites, so please don't anyone read into it, the four sites. But the first site we're going to look at is what we used to call the Landover Mall site. Now, the initial study area, and that's the area in pink that we looked at, was 258 acres altogether. But the Landover Mall site itself, which is the prime area that we would look at for a healthcare campus, is an 88-acre site. Remember, the mall opened in 1972 and it closed in 2002. The only thing left there is a Sears building and a little auto store. It is all controlled entirely by one partner, by one private partner. There are no corporations. Someone's got a Washington cap back there, the same people who own the Nationals. So the facility is, again, one ownership control. It has very, very good beltway visibility. It has excellent highway access. But for Metro, the distances are a little longer. There are 3 Metro stations close. Largo is 1.3 miles, Morgan Station is 1.7 miles, and Landover is 2.3 miles. So this opportunity is there for that site. It's one of the 4 sites that we studied. Next is the Woodmore Town Center, the location of Prince George's County's Wegmans, Costco, a very growing, successful retail development just down the Beltway, really across the Beltway from the Landover Mall site. Again, there are multiple locations on this site. It's a 250-acre site altogether. The developed area where the Wegmans is about 50 acres out of it, so we have multiple locations in this site that could accommodate a 40 or 50-acre medical campus. You could have one site we've looked at is really right north of the Costco, right fronting the Beltway. That's an area that's currently zoned for office, but there are other locations, as you can see there. On the Landover Road side, we have multiple private owners, and so there'll be some assemblage issues. Highway access is good, but one of the issues we will acknowledge is an ambulance, if you will, driving through the facility. There are people who would be living there, townhouses, the shopping, and so forth. So the access is important. There are two ways in and out, but those roads do go near residential communities, and we're aware of that. There are other transportation improvements. And of course, the closest metro station is the Largo Town Center at 1.5 miles. Next, we're going to talk about the Largo Town Center. The study area that you see there, and this surrounds the metro station there and the former location of the Capitol Center, or now the boulevard at the Capitol Center. It's a 123-acre site that we looked at altogether. Prince George's County's own Revenue Authority owns the 70-acre site that used to be the Capitol Center, and that is leased for 99 years to a private entity that controls it and has all the retail establishments that you see on there. So again, that site, the larger site, is owned by the Revenue Authority, by the county, 99-year lease with a private entity with multitude of commercial leases. There are other private sites there. The site just to the south is a 19-acre site owned by Peter Schwartz, a private entity, and there are some other sites nearby with just to the northeast that are privately owned, right now planned for residential. Again, this site has superb beltway visibility, multiple locations, multiple beltway exit ramps in and out, and great highway access. And of course, it is right next to a metro station. So it offers a great many advantages from a transportation standpoint, and some of the amenities that would also serve a medical campus are already there. But of course, again, the 99-year lease is a factor that we take into consideration. Finally, we're going to talk about the Morgan Boulevard metro area. This study area, it was 230 acres altogether. There are a number of different private and public property owners. The area, kind of the big square area to the top and the left, is owned by the Maryland National Capital and Parking Commission. WMATA owns some of the areas just to the east of the metro station. The Prince George's County actually owns some land there. The study acre of 230 acres did not include the Summerfield housing project, which is about a 100-acre site. That was a former military housing complex, now in private hands, but a lease that expires in 2015. And so while it wasn't included in the area, some people have talked about that potentially being a site. Now, of course, it's developed now. There are a lot of buildings on it. And this site, of course, is right now by a metro station. It is actually a development district overlay zone, a DDOZ, and I neglected to mention that the Largo Town Center also has that zoning capacity, which is a zone overlay that anticipates transit-oriented development. So that is a quick overview of the four sites, and we invite your comments, and I think Mr. Seaman is going to, in terms of, or is going to make the final comments, but that is trying to give you a sense of where these facilities are, where the hospital could be. So thank you very much.
Before Ms. Akins comes forward to kind of facilitate the public part of this, I've been waiting for this moment to get as many people in this room as possible so I could make one statement. And that statement is that no site has been selected for this hospital yet, okay? I've heard that from a number of people, and I wanted to tell you myself there has not been a site selected for this hospital yet, okay? Thank you. Vanessa.
Thank you, Mr. Seaman. I want to tell you that over 350 of your residents have come out this evening to hear this important topic, so that you need to give yourselves a great hand. So you've probably seen a lot of movement going on, but you have your neighbors in our overflow room who are also going to want to speak on this topic. So I'm going to give you the ground rules. The intent of tonight's meeting is to hear comments from you, our stakeholder and residents. For those who wish to speak, we're asking that you come to the center aisle, and from the other room, we're going to ask them, and we're going to move this podium over to the side so that we can bring other residents in. This is not an opportunity to engage into questions and debates, but it is an opportunity for you to provide comments on the sites presented to you this evening. We are asking that you limit your comments to 3 minutes to allow everyone who wishes to speak an opportunity. We know that this is an important topic, but I ask you to limit your comments to 3 minutes. So I'm thanking you in advance, and we're going to now, you want to begin, Chrissy is going to ask you to come to the center aisle. I'm going to move this to the side. As you see, we have residents already moving in to provide comments. Thank you, and thank you for your patience, and thank you for coming out. And probably the best way to do it, to make sure that we get everyone in, we'll take one from this side, and one from this side, and one from this side, and one from this side, because we want to make sure that everyone gets an opportunity.
Thank you, Vanessa. For the record, Charles Renninger, I'm president of the Largo Civic Association, and I would specifically speak in favor of the Largo Town Center site for the new hospital facility. In reviewing the criteria that you're looking for, access to the transportation network, as you know, that particular site has direct access to the Beltway through 3 interchanges. It also has direct access to the metro station. And for the information for all the citizens in this room, we as taxpayers have already spent over $400 million for infrastructure at that location in anticipation of a major user being located there. We have been waiting 25 years for a major user there, and we have lobbied both the state and the county for a major user there. There are, as you mentioned, sufficient acreages there to accommodate not only your present facility that you're proposing, but also through redevelopment, additional development in that same area. Sandwiched between the Beltway and Route 202, the properties are all zoned I3, which is an office-type use. It would provide opportunities in the future to expand and auxiliary service to exist in those facilities. You would also be in very close proximity, and I don't know if you thought about this, UMUC has a training facility here in Largo. It is within very close proximity to this location, so you might be able to facilitate using cross-training at the hospital and at the school. We also have auxiliary other services available there, and private entities that may want to serve and build offices for doctors and labs and technicians, etc., would be able to avail themselves and provide that economic stimulus. You would be the economic stimulus to bring that development to that location. Again, we in Largo have been waiting 25 years for this site to be developed, and we as taxpayers have already spent a great deal of money on this location, and we would urge our public officials to take benefit of those facilities that are already there. I will also point out that you're looking at the cost of infrastructure. The Capitol Center, when it operated, had water and sewer facilities that served it for large capacity. I believe when you look at the infrastructure for water and sewer, that there is infrastructure already in the vicinity of the location at the town center that you would be looking at, so you wouldn't have that additional cost to be burdened. And as was pointed out, the county already owns 70 acres at that site. Thank you very much, Vanessa. Thank you.
I just had additional questions about the last person that spoke. He spoke about additional costs for each site. I just want him to go into detail about which site would cost more from the county's perspective to develop, and also what is the time frame for actually building the hospital. I didn't see anybody, or I didn't hear anybody mention that, because if we're talking 2025 or later than that, it's really immaterial. So just wanted to know when they thought about building the hospital.
We're going to take all questions under consideration, and we will answer. Again, we're asking you to comment on the 4 sites that you've seen this evening. Someone is making sure that we capture all the questions, and if you visit our website in the future, we will respond to all questions. Thank you.
Good evening. My name is Leon Harris, and I'm here representing Progressive Chevrolet. To county officials and others, thank you for holding this hearing and allowing for community input. The planning, siting, and design of this regional medical center must be tied to a vision for the future of this county. We at Progressive Chevrolet believe that this vision should include at least the following. Point number one, the new regional medical center should serve as the hub for developing a world-class integrated health system. Therefore, wherever the hospital is located, it must take this into consideration. We are not just building a hospital. We see this hospital as an opportunity to look at developing a county-wide system that, in addition to an acute care facility with a trauma center, inpatient and outpatient services. We also anticipate that this center will have a program of integrated health promotion, disease prevention, and primary care, including community-based care clinics, community outreach programs, and relationships with other private primary care providers, specialists, and other hospitals. Point number two, the location of the new hospital must be seen as part of a county-wide economic development plan that promotes strong growth while building livable, financially sustainable communities. This means connecting a hospital center to a larger mixed-use environment where people can work, shop, and live, which will attract and retain highly sought-after skilled healthcare workers, as well as benefiting local residents. This also means that the hospital should be located at a metro center that also offers frequent bus shuttle service and easy access to the Beltway to maximize accessibility for patients and staff. Locating at a metro center will help realize the goal of expanding transit-oriented development, creating jobs for Prince George's County residents both at the facility and at other ancillary businesses that are sure to follow. Although building at a metro may cost more upfront, it should be evident from other metro sites in the region that has supported substantial transit-oriented development that in the long run it will be more economically beneficial. And the last point, the location of the new hospital must be seen as central to a strong, sustainable environmental plan, which includes reduced transportation costs, greater energy efficiency, and regulated air quality. Thank you.
Thank you. We saw that you had your comments in writing, and if you would like to leave those comments with us, we'll be more than glad to take them.